Bermuda Village. This morning we are very pleased and blessed to announce Understanding Your Bermuda Village Healthcare Benefits. This is important to us. It has changed. It has gone back and forth. Medicare and COVID have not been kind to us. So kindly listen. This will be on the portal. Take notes if you wish and ask questions. Our presenters today are Emma Powell, Director of the Healthcare Operations here at Bermuda Village. So all of healthcare is under Emma. Ashley Conley is Skilled Nursing Admissions and Marketing Director for all the care areas. Under Ashley is Brandy, who is also supportive in the care admissions. Things change around here as far as who does what and how they do it. But we want you to feel comfortable with it, and we want to welcome our speakers. Thank you.
Okay, good morning. As Ms. Keller said, I'm Emma Paul. I've been here about 7 years in a few different capacities. I did serve as the Director of Operations when I first got here. And then in the last, about a year and a half ago, we made just some structural changes just in time for COVID. That was the bonus, I guess. But we made some changes where I took a focus more in our care areas, because our care areas, for those of you who have been here a while, you know, they are just growing. We've expanded. We have gone from 3 skilled nursing home beds to 36, which is a pretty big deal. There's a lot that goes into managing and running a skilled nursing home. And doing 3 beds, it was a lot easier than 36. So we just have been putting more focus on our care areas, which is what sparked my transition to just focus on care areas. I'm a skilled nursing home administrator and an assisted living administrator, and I've been in the industry my whole life. My family works in the industry, and I've been around all sorts of different type of care areas and settings, and just was really raised in this industry. So it's a little bit about myself. But today, like Ms. Keller said, we are going to talk about understanding your healthcare benefits here at Bermuda Village. They have changed. There is some inconsistencies that at this time it's not really in our control, and it is due to COVID. So we're going to take some questions at the end, but we came up with the FAQ section of things that we have seen that have maybe caused some confusion. So we'll go over that, and then we'll open it up for questions, and I apologize if things are confusing. We do try our best to make it as streamlined as possible, but there are COVID-related restrictions that might have to have us change how we do a certain process. So we'll go into that a little bit. Okay, here we go. So this is we're going to start just a brief overview of our healthcare settings or services here at Bermuda Village. These are things that are included in your monthly service fee. We do have the emergency pull cord response system, and we are going to break down and go into each of these categories. But again, this is just a quick overview. This is the emergency pull cord response system. We also have 15 infirmary days. The health center nurse triage, and that is when it's available, and that's going to be one of those things that's a little tricky with COVID. But again, we're going to get into that. We do also have some healthcare services that are available, but there are additional charges for this. That would be the emergency pendant system. And then we also do have a lot of different care areas on campus here that are options. And as far as we don't go a lot into detail about the emergency pendant system, but just to make you aware, that is something that you're able to purchase. You go through our community liaison, Mary Beth, who's here with us today as well, and she can get the process rolling for you. There is a charge for the pendant, and we do once you do get it, our maintenance will help you set it up and program some numbers, and we can have it call our front desk. So in the event that you are on campus, and that is a little bit of a caveat about it. There's a short range for where they do work, but all of that you can get with Mary Beth and see if this pendant is an option for you. And that's something that we can, again, program to call our front desk if you have a need. Okay, so to start, we're going to talk about the emergency pull cord response system. I separated it into 2 different categories here because it works a little different. In the villas, in order for your pull cords, and you probably have seen them if you have a villa, in the bedroom and the bathroom. And I want to be careful because there has been a lot of some changes and renovations to some villas, so I don't want to make a blanket statement and say it's in every bathroom and every bedroom. But for the most part, that is how they were designed. We do know that it is in the master bedroom. You'll see a pull cord, and then they have them in the bathrooms. But for the villas, in order for your pull cords to work, you do have to have an active phone line because they do work off of a phone line. So you would need to get with a Gatel or maybe like a Spectrum, and you do have to have that active phone line for that pull cord to work. Because what happens is when you pull it, it dials and calls the front desk and communicates with our system up here. And we're going to talk about that process. So if you live in a villa and you do need to have an active phone line for it to work, front desk will do periodic checks on your pull cords with you to make sure that they're working. So I want to talk about a little bit what happens when you press your pull cord. And here it is. So step one, you activate or you pull that pull cord. What happens is it dials and rings to the front desk. The front desk is going to hear beeping, and they're going to go to a panel, and they're going to see the address in which the pull cord is being pulled. At that point, the front desk is going to immediately call. We have phone numbers, house numbers on file at the front desk, and so please keep those up to date. That's very important. So we will call the property and say, hey, was this a mistake, or what's going on? If you are able to answer your phone, at that point the front desk is going to try to figure out, is this an emergency 911 situation, or can we just bring a team member to the home and just kind of just evaluate the situation. So we will do a little bit of that, and our front desk does have criteria that we're also going to review for what's 911 versus a team member coming to your property. So that's what they're going to do. They're going to assess the situation and see if assistance is needed. If there's no answer when we call, we automatically are going to send a team member to the property because it might be that you can't get to your phone and maybe there's a lot going on. So no answer, we're sending people to the property. Once we are there, the team member will proceed to the home and evaluate the situation, and we'll help call 911 if needed, and we'll call the emergency contact if we're able. So that's another part. We do have emergency contact sheets that when you move in, that we ask that are filled out, and we keep them on site. That's very important that information does stay current. A couple weeks ago, I was involved in one. This was just an incident that happened on campus, and so we went straight to the emergency contact sheet, and it worked perfectly. We were able to call the family members and get some assistance. Had that sheet not have been in there, we would have no one to follow up with. So it's very important that you do have that information up to date. You can take it up to the front desk, and they know what to do with it. We have a process where we store them in the health center, and we also do document the stuff in our electronic health record. So the condo pull cord system, it's exactly that same 4-step that we talked about. There's just one difference. The condos, you do not need to do anything special to have your pull cords working. They are pre-wired in the building, and they work with or without that active phone line. So it's just a little simpler in the condo. So I just kind of made note, again, pull cords in the condos work with or without an active phone line. Pull cords, again, are located in the bathrooms in the master bedroom. And again, at minimum. Sometimes construction happens, and that can differ. So same process. Front desk is notified just the same way. We look at the location, we call the property, and we proceed by sending team members. Sometimes, though, we do get pull cords in their accidents, and we don't send anyone as long as we get the okay. You're like, that was my fault. I was cleaning. Maybe sometimes a housekeeper might accidentally pull it. But we send people, and then we assess, and we assist with emergency personnel if needed. So we're going to go a little bit more in depth about when to utilize this pull cord, because this is questions that we get frequently. So the green check mark here. If you have fallen, dizziness or confusion, new onset of shortness of breath, a cut or injury, severe headache or nausea, or general weakness. Those are all reasons in which you might want to pull that pull cord, and you can just say, listen, something's just not right. I've had this change, and then we can send someone up to the property. These are reasons in which not to utilize the pull cord. Just routine care. This is not designed to say, I do need assistance using the restroom, or can you help? Can you bring me my walker? things like that. That is not what this is intended for. These are the pull cords are for emergency reasons. Now, maybe you are in your chair and maybe you're just not feeling well, and you at that point, if this is a change, and you're like, I need someone to come up here, maybe help me get to my walker so I can proceed to do what I need to do. That is different. It's just, that's not a routine service that we can offer. Wound care, bandage changes, etc. So, a lot of people might have wound care that needs to be addressed, and it's done at a certain frequency. That is not something that we can send someone to your condo to do. Even though I know we get phone calls asking, like, hey, I have to do this wound change for 2 weeks, twice a week, can someone come up? That is not something that we're able to send a team member up to the condo for. Services like that, this is going to be one of those COVID things that we're going to touch on soon, so just be patient, because that is something that we can help with. It's just through COVID, it's going to be depending on what our current outbreak status is. So we'll get to that in a minute. Also, we are not able to go up there and do medication administration. Okay, so these are situations in which please do not pull your pull cord if these things are happening. Call 911 first, and then we ask that you pull your pull cord if you're able to. If you have a fall and you have an open wound, chest pain, stroke-like symptoms with like numbness, tingling, confusion, etc., bleeding uncontrollably, trouble breathing or shortness of breath, low blood sugar or diabetic episodes. And just to let you know, what happens is after you do call 911 for those things, and if you are able to pull that pull cord, we will still come up there, and we will be there when EMS gets there. We will send a team member, whether it be a representative from the health center or maybe our supportive care area. We will send someone to be up there with you to kind of help navigate when EMS gets there, and to also help communicate with your family if you would like us to call your family, just to let them know what's going on. And if you're being transported, we can communicate that as well. Okay, so at this point, I'm going to turn the section over to Ashley Conley. She, as Ms. Keller said, she does our marketing and admissions, specifically into the skilled nursing, and she does oversee all the admissions into our supportive care areas, and she's going to go over our infirmary days.
Hello everyone. As Emma said, I'm Ashley, so thank you for having me here today. It's nice to see everyone and get to talk about the things I do every day. So infirmary stays. What is infirmary? Infirmary is 24/7 care and oversight in a designated care area, whether it be health center or Greystone. Each IL resident that moves in gets 15 free days per year. Those are per calendar year, so they don't roll over. And when we say free, the free is for the room and board. So whichever area you're staying in, the room and board will be completely covered. But there could be additional charges for things like medication copays, supplies, therapy services, things like that. Historically, we have always done infirmary in the health center. As Emma said before, we only had 3 licensed skilled beds, so it was a lot easier to do infirmary quickly on rather short notice because it was a different licensure. So now with our licensure and with all of our COVID restrictions, if we cannot do your infirmary stay in the health center, or you don't really need the true skilled infirmary stay, we do make arrangements for that to be done in Greystone. So when would you use infirmary? So infirmary can be used after quite a few different things. After a hospital stay, respite care for a spouse. So a lot of times respite care and infirmary can be used a little bit interchangeably, but the key to remember is infirmary is a little special to Bermuda Village. Those are your 15 free days. We also do respite care, but that would be more for if you do not have the infirmary days, or maybe you've already used all of your infirmary days. You can still stay in a care area for a short period of time, but it would be at a private pay rate. And that's what respite care is. Also, if you're recovering from any type of outpatient procedure or any recent illness, and maybe you just don't feel well enough to stay at home alone, and you just need a little extra care. So how do you go about utilizing infirmary? You just give me a call. We will always talk about the situation, what's going on, and that way we can coordinate whether you really need to be in the health center or we can make something work in Greystone. I always talk with our clinical team to kind of see what they think. Things are a little different now. In order to come infirmary or respite, we do have to have information from your primary care doctor. This form is called an FL2, so this is at minimum, so we know your condition, medications that you take, that sort of thing. So this is a mandated form by the state that we have to have. So infirmary can sometimes range. If you call me, I would love to say I'd love to make things happen immediately, but that's just usually not the case. It will depend on your PCP and how quickly they respond. So typically we say anywhere from 24 to 72 hours, just depending on the doctor. Which kind of leads us into our next slide. So historically, you could come on the drop of a dime. You could just say you weren't feeling well and come down. But again, with our licensure change, we have to do things a little more regimented. But the staff can provide all the basic care, such as, just kidding, I've wrote it into your slide.
No, you're fine. You were looking for a FAQ question.
I was. Sorry, guys. So this is all for infirmary and respite. And then Emma is going to talk to you about the health center nurse triage. I got a little carried away, guys.
Keep on going. So yeah, and we'll touch a little bit more on infirmary because I know there's a lot of misconceptions about infirmary and some frequently asked questions that we'll kind of cover, and then we'll also open it up later for any more questions. So before we were talking about situations like maybe you have a wound, wound care need, and maybe it's twice a week for 2 weeks, and you're like, I just don't want to have to drive out somewhere and get this taken care of. Is this something you can help me with? So this is going to be one of those weird COVID outbreak status scenarios. So I want to kind of go into a little bit about COVID and explaining what outbreak means. That sounds a lot worse than it is. If we have one person, resident or team member, test positive, and does not matter if they have symptoms or not, if we discover a positive test through routine testing, we are outbreak status, one person, and I can't even count the number of times that we were outbreak status because we had a positive case and there was not a darn thing wrong with anybody. It's just as soon as we see that result and we've been caught in, we will have a positive test. We do a second test, it's negative. A third test, it's negative. 2 days later, another test, negative. But nobody cares. They just see that positive test. They're like, nope, that was positive. You are outbreak status. And that brings on a lot of changes that has affected the services that we offer. So the nurse triage is one of those services. So historically, we would have hours posted, and we were like, hey, if you need to come down, if you're like, can you just do my blood pressure? Can you check my pulse ox? I'm just not feeling too good. You could come down to the health center and you could see a nurse, and then we would just kind of check you out and see what's going on. And that was a pretty open concept. When I first came here, we did have like hours posted on the door, but because of we have a lot of nurses down there, it really is people could just come down and we would just see what was going on. Unfortunately, as soon as the health center is deemed outbreak status, we are not allowed to let anyone through those doors. That's visitors, that's our own independent living residents. No one can come down there. So that's caused a lot of changes with how we are doing this triage service. And so at first, we're like, that's fine. I guess we're just going to have to be prepared to go to more house calls. But then we're like, wait, we can't send our nurses out of this center because we're outbreak status. Regardless of if it was real or not, we have to just treat every positive case as if though we had an exposure. So then wheels are turning, trying to adjust to how we can still offer this service. So this is where we kind of enter what we call our supportive care team. And we're going to get into little details here about our different care areas, and you're going to see the difference between supportive care and maybe like our skilled nursing home team. So our supportive care team members, they care for everyone in catered living in Greystone. They are trained and they do know how to respond to situations. They do know how to do basic evaluations as much as a CNA can do. And so they are trained in a certain matter. So we can utilize the supportive care team members to do the pull cord response system. However, having them respond to do maybe the wound changes and things like that, it's just a little bit out of their scope. So This is a service that is offered whenever we are not outbreak status. If we are under outbreak status, we are not able to send a nurse to every individual home because they can't leave the health center. So what we ask, so you don't have to constantly keep up with it. If you have a need, you can call the front desk. The front desk is aware of our status, and at that point, they can make you aware whether or not that's a service we're able to offer. And this is why I think there has been so much confusion, because I might call on Monday and say, I need this, and we can say, come on down, we'll take care of it. Come down to the health center. 3 days later, my neighbor calls for something similar, and they're told, I'm so sorry, we cannot accommodate that. It's not because they like me more than my neighbor. It's because maybe the situation has changed with COVID and our outbreak status. So we are going to try our best to accommodate any requests we get. But we also don't want to cause that layer of confusion that it causes, because that's when we get, yes, you can, no, you can't. So again, if you have the needs, you can call the front desk and they will put the request in, and we kind of have our own internal behind-the-scenes process of how that works. I don't even know what the slide says. I hope I said it all. Oh, yes, historically, independent living residents could come down to the health center. We talked about that, and doing that to be able to consistently offer the services. We are not officially saying, we haven't really officially announced like, hey, yes, we can accommodate walk-ins. It really is, it's a day-by-day thing. We want to be as flexible as possible and as consistent as possible, and sometimes we cannot accomplish both. But if you have a need, please just call, and we are going to do what we can, or we'll point you in the direction of what you need to do at that time. Let's see. Now we're going to go into something that was brought to my attention. We had the resident association meeting last week, and I found that I was told that there's a big need for people to understand the care areas and what we offer on campus. You are very clearly familiar with our independent living services, but what we're going to do is we're going to talk a little bit about on campus what else we offer, what other care settings we offer. So the first is called enhanced care services. There was a change made in February this year. The enhanced care service program is being faded out. So what happened, and I'll explain what it is, but let me tell you first, in order to be eligible for the enhanced care services, you do have to reside in a condo. This service is provided to condo owners or people who live in the condo, but you also have to have lived here before February 1st, 2021 to get these services. So now in enhanced care, so let's say that I've been here 5 years, and I'm a condo owner, and I'm needing more assistance. I need some help in my condo. This is what we'll capture this care. We can say, well, we're going to do an evaluation, and we're going to determine, can we do this care for you in your condo? If we can offer this program safely and you stay in your condo, it's called enhanced living. So during this, this is going to be very repetitive because we do have the 3 areas. We have enhanced living, catered living, and Greystone. That's all under the supportive care umbrella. We offer the same services in every single one of these. However, they're just carried out a little differently just because of logistically where you're living. So we'll get into that. But enhanced care, you're living, you can be 2nd floor Magnolia, you could be 1st floor Redbud. As long as you lived here prior to February 1st, 2021, and you are eligible for the program, you can sign up. Once you sign up for the enhanced care services, you're going to get 24/7 care supervision. All 3 of your meals are going to be included with your enhanced living. So you'll have an option to have all these meals delivered to your room, or you do have an option to go dine on the catered living dining room. You can go eat in Greystone dining room, or you can utilize the main clubhouse. So I'm not going to go full into like sales pitch mode with this. If the need ever arises, Brandy will work with you very carefully and make sure you understand the services. But other things that it includes, we do medical transportation, light daily housekeeping, personal laundry service, and we do have a robust activities program. All enhanced care residents must be able to communicate and participate in their plan of care. We are not able to accommodate anyone that's totally dependent on staffing for transfers and toileting. To ensure that your needs can be met in the enhanced care program, All residents must be assessed prior to starting care. So we're going to move to catered living. Catered living, again, this is condos. Catered living is the whole second floor of Redbud. So anyone that lives on the second floor is in this catered living program. And again, the services are the same. We literally copied and pasted 24/7 care supervision, meals, medication oversight. I'm sorry, I did not say that from the last one, but that is included. Assistance with your activities of daily living, medical transportation, housekeeping, laundry. So all of that is included. The difference, so I want you to visualize, we're in the Magnolia building. We have a lot of condos. I don't remember off the top of my head. About how many condos are in Magnolia? 150. In Magnolia. It's 70, yeah, I thought that was like 70. Okay, so we're in Magnolia, and I live on the second floor. There's 75 other condos between these 3 floors. You have all these long, long hallways. We might have 4 people in the enhanced living program. That is not a lot. So we'll have 1 staff member over in Magnolia, and their job is to provide services to people in this program. Logistically, though, I'm the caregiver. I'm on the second floor, and I'm just started maybe assisting with the shower. I get a phone call from someone, 3rd floor, complete opposite wing, who needs help. That can cause some delay in care, and people sometimes feel like it takes too long. Logistically, 1 team member for 4 people, 4 residents, is plenty. It's just if you have that care need and they overlap, that can cause some friction. But that is also why this program is not designed for someone who is completely dependent on the team members. So if you are going to be stuck in your chair until that person comes, that is not going to be the right setting for you. At that point, we might look into something like catered. And the reason why, even the services are the same, but on catered living, since we have 25 residents all on the program, we're going to have 5 to 6 team members on 1 floor. So they are able to really tag team. So if you have 1 team member helping provide care and someone else needs it, we have a quick fill-in. So that's one of the biggest differences between like the enhanced and the catered. It's the ability and how we can carry out that service. So I want you to, and we also have house call services that are provided by Wake Forest Health Geriatricians. And we're going to get into that in a minute. But I want you to kind of keep that same scenario in your head about the saturation of staff. So when we go to Greystone is that freestanding building that we have in between the condos and the health center. Here we have even more staff, and the beds, the rooms, the building itself is all dedicated to care. So if we have someone that really needs more task-to-task guidance, they're going to be a lot more successful in this Greystone building where you have a smaller area than the 3rd floor Magnolia where they're very isolated. So those are the kind of things that we look for when you have a need to add care. We're going to really look at the situation, and we're going to see which one of those settings are you going to be most happy in. And that is done during the assessment process that Brandy would help lead you through. But again, the actual services themselves, if we were to list this is what we do, it is the same between enhanced, catered, and Greystone. It's just how those services are provided that is different based on that environment. So again, we don't want you to really worry about that. That's something that we would do behind the scenes, and we would evaluate your needs, and we would be able to say this is where you're going to be the best taken care of in this situation. One other thing with our supportive care areas is we do have, like I mentioned before, the Wake Forest Health Geriatricians. What they do is they oversee, and they are the primary care physician for the majority of our residents in these programs. If you are approved, or you have, what is the word I'm looking for? Not approved. You have to be eligible. Then they are able to come to your individual home or room to do your visits. So a sick visit or your wellness check. But you have to be approved for that, and that is Medicare guidelines that say whether or not that's something you're eligible for. The majority of our people in our supportive care areas do happen to be eligible, so we have a very strong presence from these geriatricians, and you will see them walking along a lot, going in and out of rooms. But that's another kind of perk that we have in the care area.